All right, I'd like to welcome everyone to the March 12th, 2020 meeting of the Delaware County Board of Commissioners. Would you please rise and join me in the pledge?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you. I'm Jeff Benton, President of the Board. To my right is Vice President Gary Merrill, and to his right is our Administrator Mike Fromer. To my left is fellow Commissioner Barb Lewis, and our clerk today is Sarah DeNova. We can begin.
Resolution number 20-243, in the matter of approving the electronic record of proceedings from regular meeting held March 9th, 2020.
So moved.
Second.
Discussion. Vote.
Vote on motion 20-243. Mr. Merrill?
Aye.
Mrs. Lewis?
Aye.
Mr. Benton?
Aye.
We have no public comment this morning, but we do have a presentation from Sheila Hiddleston, Brian Gallagher, and Sean Miller.
Okay.
Good morning, Commissioners. Brian Gallagher, Director of Safety and Security. We have come before you today to discuss the county's planning and response to this point to COVID-19. Additionally, the Health Commissioner for the Delaware General Health District will speak. It is incumbent on us in safety, leadership, and response positions to provide professionalism and capability. The focus of the last couple of weeks is getting ahead, planning, not panic, utilizing the resources of the CDC, the State of Ohio, the Delaware General Health District, and EMA. The county is currently working with community partners, such as the Delaware General Health District, to maintain a safe workplace. We've created a planning team, working with all departments and offices in the county. Delaware County specific resource list and information from the CDC has been emailed to all employees by the Communications Director. Jane Hawes will be supplying additional information as time goes on and has worked with IT and created a site on the intranet for COVID-19 information. Initial planning meetings for officers and responders have occurred, and we are working through those issues and planning partners identified in those meetings, such as Steve Lewis assisting with technical means to social distancing. The new phone system has capabilities that will now be used. Chad Alshire's crew is increasing vigilance, and county employees will see a greater custodial presence during the day. As provided by the CDC, the actions of staying home when sick, effective hand washing, prevention of touching one's face, and ensuring those deemed by the CDC to be at special risk are educated and planned for are the most effective means of preventing the spread of COVID-19. I will now turn it over to Sean Miller, Director of Delaware County EMA.
Thank you, Brian.
Thank you, Brian.
Thank you, Brian. Sean Miller, Director, Delaware County Emergency Management. Commissioners, I'm going to have my remarks be extremely brief so that the Health Commissioner can speak to you. However, when we manage emergencies, we do so through collaboration, as emergency management is a team sport and unified effort. And I believe that Brian covered that succinctly with his remarks. Thus far, we've been focusing our efforts in three areas. These are as follows: supporting internal planning efforts, coordinating with first response entities, and of course, supporting the Delaware General Health District. We have been in constant contact with our public safety partners and have been sharing information with them as it becomes available, especially from the state of Ohio. Moving forward, we will scale our response efforts to the needs of the community and those of our partners. One of the actions so far from the State Emergency Management Agency is partial activation of the State Emergency Operations Center, and that is for information coordination and the initial coordination of supplies. We will continue to work with county leadership as this situation unfolds, and we will relay pertinent information as it becomes available. And with that, I want to share a phrase with you that I heard the other day because I believe it's appropriate. I can't claim it is my own, but I'm going to steal it because it's very good. Somewhere between denial and panic is preparedness, and that is our objective. And with that, I will turn it over to Sheila Hiddleston, Health Commissioner, Delaware General Health District. Thank you.
Thank you, Sean.
Yeah, thanks, John. Welcome,
Good morning,
Sheila.
Sheila Hiddleston, your Health Commissioner. I'm going to try to keep this brief as well to leave plenty of time for some questions. So I appreciate the opportunity to talk with you. I've had the opportunity to talk with a lot of your department directors, and so that was a good experience. Obviously, at the Health District, our goal is to always protect you all, and also then to prevent the spread of illnesses if something does happen. We are working diligently, I don't want to say 24/7, but pretty close to 24/7 these days, to make sure that we're on top of things. So Sean did bring over my PowerPoint that I was using the other day, and it's been updated a little bit, but I will tell you for positive, I did not update this after 4 o'clock yesterday afternoon, so some of the numbers have changed. So just very quickly.
Jane, if you could
Yeah, should
hit the lights, thank you.
Point it, at that, okay. So obviously, I'm not going to go a lot into the disease itself. I think a lot of people are very, very familiar with what's going on. We do now have cases in the state of Ohio. As of yesterday afternoon, there were 4. 3 of those had travel history, so it's not great news, but it is good news because we know where they were exposed. The 4th one, they have been unable to identify yet where the person contracted it, and so that one is a little bit more concerning because that means we might be having some community spread. So again, these numbers are not correct, but you all are aware that it is all over the world, that there are several several countries that are now under travel advisories. This slide just kind of puts this a little bit in perspective to some of our past pandemics and some of the things that we've been looking at. So you can see from looking at this that it is definitely affecting more people. There's also, this is another nice slide, and I can send these over, but I will not send them over to you until I update the numbers today, and that won't be till after 4 because that's when we get all of our new numbers. But this, again, just gives you a little bit of a comparison with what happens. The thing I want to bring a little bit of attention to, and one of the things that everyone keeps asking is, well, how infectious actually is this, and how do you compare that with other diseases? So I would tell you that the normal flu is about 1.28, what they call it the R0, that's the infectious rate. The measles is 12 to 14, so very, very high, and this one appears to be about in the 2 to 3 range. So yes, it is definitely more infectious than the flu, but not nearly as infectious as the measles are. So just to kind of keep it in perspective just a little bit. The high concern, obviously, is this is a new novel virus. Now, coronaviruses are not new. There are well-known coronaviruses that we have dealt with in the past. You might remember SARS and MERS in the past few years. Those are both coronaviruses. The thing that concerns public health when we have something new is there's just a lot of things we don't know. Now, we know basic disease information, and we know how to prevent the spread of respiratory versus fecal oral. I mean, we know how to do all of those things. So we do know that this is respiratory. We also know that there is some droplet spread, which means that surfaces can have the virus live on them, so cleaning of your hard surfaces. What we don't know yet is how long does it actually last on a surface. So to put that in perspective, when HIV came out in the early 80s and the 90s, and we learned more and more about that, people were so worried about there being blood on a surface that they didn't know about. Well, first off, if the blood is dried, very little risk, and HIV is a very, very, very fragile virus, and so it isn't going to live on surfaces. You're probably never going to pick it up that way, as opposed to hepatitis B lives on surfaces for a long period of time. And so, to kind of keep that in perspective, we don't know yet about the COVID-19, how long it's going to live on a surface. So we do know that wiping of those surfaces is very important. We also know that because this is respiratory, the further away from somebody that you can stand, probably the better you're going to be. 3 to 6 feet would be ideal. 6 feet obviously better than 3, but much better than sitting right next to someone. And one of the questions that we've been working with not only our community partners, but our schools, regular calling back and forth trying to determine what is a large gathering, when should we start canceling meetings. I know the commissioners are aware we have our district advisory council meeting tonight. That's a mandated meeting that the health district has to have with our townships, villages, cities, and our commissioners every year. And I've already been asked, are we going to cancel that? And I said, well, let's just break this down. Number one, it's not a large gathering, probably less than 30 people. Number two, it is mandated by the ORC, so if we cancel it, we have to figure out another way to have it, and the law says it has to be in March. It is a public meeting, so we can't just videotape it because that would violate all of the Open Meetings Act. And we also don't have any community spread of COVID in our community yet. Will we have it? Probably, but we don't have it yet. So when you think about those large gatherings, and I do know that the governor sometime today, we've been told, is going to come out with some definitions of what is a large gathering, what will we require to be canceled, what will it be up to the individual localities to decide. I was just sharing, I don't know that it's an exact number. I think you really truly need to look at who is your audience, who are the participants, where is the venue. So if you look around this room, what is there, about 30 of us in here? And we're not sitting on top of each other, but we're also not distanced very much. But it's a small gathering. We're only going to be in here, well, I'm not going to be in here for very long. I don't know how long your meetings usually last, but we're not going to be in this close quarters for a long, long period of time, so you would take those things into consideration. Obviously, if it's outside, that's better because, you know, we have the airflow that's going by. But to really look at those individual events and determine what is our actual risk of people being exposed to things. Now, you've been hearing on the news for the last few days, and we do know that one of the Cuyahoga cases did attend a conference in Washington, D.C., where there was one person that was confirmed as having COVID-19, and so there's been a lot of talk about, well, what about a conference attendee? Heard on the news this morning, my staff were just sharing with me, there was another conference recently that we may have had some attendees to. So we're following up with those. Should they stay self-quarantined? Do we need to monitor them? Do they just need to watch themselves for symptoms? So all of those guidelines are forthcoming. If we do have someone that we know has been exposed to a COVID-19, almost said 14, they have to be quarantined for 14 days, and we are going to monitor them every single day. So if they have been exposed, that is our responsibility. They can't have anybody coming and going in their house. They're not allowed to leave their house, and they have to stay in their home for 14 days. Now, if they have family members, what we're doing is social distancing within the home. Ideally, they have a basement or an upstairs or some place that they could be far away from their family, ideally a separate bathroom so they wouldn't have to share the bathroom, and then, of course, really good hand washing and those kinds of things. If they have a immunocompromised family member, we may have that person maybe wear a mask if they were going to be coming in contact, or seeing if they could go stay somewhere else. But family members of someone that's been exposed at this point do not have to also be quarantined. So our key messages, I think, just as I think Brian said, you know, this is rapidly evolving. I put together my little book, and I think every day I take something out and put something else in because I want to make sure I always have the most up-to-date information. We were just in a little briefing this morning with my team, and that's probably one of the hardest things at this time, is making sure that we always have the most up-to-date. And so we are in incident command. We've been in incident command, I think it's been almost 8 weeks now, and we are slowly adding additional positions to that because as this grows, we need someone. And today, when we meet at 11 o'clock, I'm actually going to assign somebody just to be our information guru to keep up with the CDC website and the World Health Organization, so that whenever we're speaking with the public or getting questions, that we always have the most up-to-date information. The testing, that's been a real big issue for people. Remember, please don't look at these numbers. Those were from 2 days ago. Testing has been a big question. I know that there was a little bit of a concern that the rollout of getting this testing going in the United States was really slow. I know there's been some criticism about that. I'm not going to talk about that. You know, I know how hard my team is working. I know how hard the other people are working on this. I'm sure they were doing the absolute best that they could do to get things going. We do have testing capabilities here in Ohio. We can do those through the Ohio Department of Health lab. There are also private labs that are now doing them for us. If we take care of doing all of that, there is no charge. It's done through the Ohio Department of Health lab. We will take that that specimen immediately to the lab to be tested in the same day, and within 24 hours, we will typically get those results. If it's a private provider that orders it and he doesn't go through us, I will still know if they do order a test, just so you know. That is a requirement. The labs have to let us know that. But if they go through a private lab, it could take a few more days to get those results, but testing is available. Here's what testing is not, and I know this is really, really hard. You can't walk into the health district and we can't test you. We can't come to your home and test you. You can't go into the hospital and be tested. Because these tests are still in a fairly limited capability, we have very strict criteria of who can be tested. Now, that isn't to say that your private physician can't order that test directly and your insurance pay for it. If your physician feels like that's important that you get tested, that would be something, that would be a conversation between you and him. But we need to remember that we don't have community spread right now in Delaware County. We need to reserve those tests for the people who really truly need to be tested. And we don't want a panic of people thinking that every single person needs to be tested, because this is a disease that theoretically lasts for about 14 days. So what does that mean then? Every 14 days we're going to test you? That would not be very bright, and it certainly would not be a good use of our equipment. So anything that all of you can do to help people to understand that, they can call and ask us. I had a lady very, very angry with me yesterday, wanted to know why I wasn't going to come to her home and test her. I'm seriously very angry and at the whole system, and I can't do anything about the system. All I can do is answer her questions. But we just need to realize we need to take care of our fragile community, our hospitalized patients, our healthcare workers who are taking care of those hospitalized patients. So those are the people that those tests are being reserved for initially, and then as that production ramps up, we will be able to do a little bit more testing, but we're still, I won't say 100% I'm positive, but I am 99.9% positive we are never going to be testing well people. This is not a screening that we're doing like we recommend that you have for prostate cancer and your breast cancer. And this is not a screening. This is a test to see if you have the COVID-19. So our risk in Ohio, as you know, we now have 4 cases. There are more testing going on. I can share with you, now again, those numbers are not correct because we have 4 cases now. So just to kind of talk a little bit about the definitions, a PUI, person under investigation, is someone that is being tested, okay? So we've had lots of negative PUIs. That's a good thing. A lot of the folks that we've been working with were positive for the flu. You all know the flu has been much worse this year. I don't know that anyone ever in the past would have said a positive flu is a good thing, but in this case, a positive flu is a good thing because it's not coronavirus. And we know so much more about the flu and how to do supportive therapies and for it and how long it lasts and all of those kinds of things. Then as a health district, we are following up on anyone that's a traveler to one of those one of those countries that's under those advisories. We have people that are quarantined. We are doing daily monitoring of them. If they get sick, we're not just saying we'll just go to the hospital. We're not being lackadaisical. That isn't the word I was looking for. We have a conversation with the person. We're calling the infectious disease people at the hospital. We're talking back and forth about who needs to be tested, should they be tested, how are we going to get this done. These people, if they do have to go to the hospital to be tested, all of those arrangements are made all behind the scenes. They are not walking through the lobbies of hospitals to be tested. They're going in back doors. Somebody's meeting them right at their car, getting them right up, doing all of the respiratory panel, checking for flu first, and then we'll make those decisions about whether or not they need to be tested for the coronavirus. But I know that somebody I talked to yesterday was really worried that people are just walking into the hospital to be tested. I can't promise you that there aren't some people that are doing that. I can promise you that if it is somebody that we are following, that is not happening. They are not just wandering into the hospital. We're also recommending to our public, if you're sick, don't just go to the hospital or your doctor's office. Call them first. I know one of the things at Brian's meeting, those of you that have the county's insurance, you all have a telemedicine option. Do that first. Talk to the doctor on the phone and see, what kinds of symptoms do you have, and then they're going to be able to make some recommendations. But certainly, you don't want to be going into an office. I know when my children were young, we had a well waiting room at the pediatrician's and a sick waiting room, and that's an excellent thing to do. Your doctor's office probably has some guidelines. They may not have separate waiting rooms, but they might have guidelines about. I'm going to have to step out for just a second. Just keep talking. I'll be right
Those are some pretty big shoes to fill, so I'm going to keep it at a very high level. If you saw the governor speak yesterday and Dr. Acton, one of the things that they talked about, and to kind of springboard off of what the health commissioner was talking about, with a lot of these social distancing measures being put in place, one of the objectives with that is to reduce an immediate spike on the healthcare system. And so if you saw Dr. Acton's chart yesterday, she had a couple of different curves on that, and one went very high, very fast. The other was a little bit flatter and spread out over time. And so that is one of the objectives with some of these measures that are being put into place, and that is kind of the overarching goal with these things currently at the state level. Yes, sir.
Yeah, I've got a question. I'll just kind of make a comment. I know Sheila might need to participate in this discussion. I think what's challenging for the county is, there's obviously the social distancing and how we control the spread of this, okay? And that's a practice that needs to happen all over. I think what makes it more challenging for the county is that we have to then figure out how to protect our employees.
Right.
We have employees that are actually providing medical care to people that are going to be called out. And that's a whole different, ball of wax that we need to keep in the forefront. But then we have employees where people are coming into, we have to service, whether it be an auditor's payment or something like that. And so we have to figure out how we best protect those employees. So this is to me, there's like three different components to this. And being a service organization like the county, it's a challenge to, one plan is not going to adopt it, take care of everything. It's going to have multifaceted.
We've been working with the health district, and they've been, able, actually, Bob Anderson has them coming over tomorrow to conduct some training as far as the people to interact with the public, as well as those, are you doing also the going out to the homes?
Yes, we have plans.
On what action to take. For example, one of the things that the health commissioner had mentioned was, their people, when they go up and they knock on the door, they take 3 steps back, so that way if someone comes, to the door and they sneeze or something like that, they're already back. It's actually not a bad idea to do, as well as somebody has a dog or something of that nature that would be there. Just simple steps that we may not have done in the past, that they have the expertise and they're going to be providing training. And we'll be getting that out to those organizations, and having contact with the health district to be able to provide that.
Sheila, I was just mentioning that.
I'm so sorry. I've got 3 calls I'm waiting for, and that was one of them.
No, I was just mentioning that as a county, we provide services. And obviously, we have an obligation to lead in helping control the spread of this by social distancing, meeting cancellations, things of that nature. But then we also have the protection of our employees that are providing, like what Brian said with JFS, non-emergency services. But then we also have our emergency services folks. So I think we need to keep all these channels separate as we work through them, so that we have effective a plan that addresses each 3. Is the guidance that's out there, like the CDC, is it more, I'm assuming that's more slated towards control of this, not necessarily employee protection, or is it all?
Actually, you mentioned the great resource. So the CDC website it's perfect. I mean, it really is doing a nice job, and there are very specific guidelines for businesses. I just sent one of them to Bob this morning because he had a couple questions about that. Healthcare organizations, schools, daycares, extended care facilities, because our long-term care facilities have a lot of elderly people, and that is the group that this disease seems to be affecting the most. So there is very different guidance for protection and the control of the spread for each of those individuals. I know with the home visitors Alpha Group, Liz Owens, you probably all know her. One of my staff is going there today to talk with her because their staff actually go in and give baths and things. And so a little bit of a discussion about what kinds of things can you do that. If you're just making a general home visit, just don't sit very close to the person. And obviously, when you get there, if that person's sick, don't go in. Make arrangements to go another time. Now, That's difficult, and Bob and I talked a little bit, if you're a children's services worker and you have to be able to see how the home is and how the child is and how the parents interact, that's going to be a little bit more difficult, so we may have to get creative in how can we do that. I know the public meeting issue. I've had lots of people say, well, can't we just not let anybody come to our public meetings and we'll just videotape them? Well, that would be against the law at this point because these are public meetings and we're all subject to the Open Meetings Act, but maybe there is a legislative initiative that could happen in case we need to really do a little bit more social distancing. I know the schools, when I've been meeting with the superintendents, they're concerned because they have all of their requirements for how many days and how many hours. And Rick Carfagna was at our meeting I think it was last Friday, and that's another one of those legislative things that we could probably do something about in the event that we would have to cancel schools. Does that answer the question a little bit?
Yeah, no, it's great. Thank you.
And if anyone wants us to come, we are getting tons of requests right now, so we had added another ICS position, and that's what she is doing, is coordinating the requests for information, who the audience is, and what kinds of information. Is it just general, or is it real specific? How would we respond in this particular situation? I'm so sorry I had to leave. So travelers, you all know that there are certain countries that you're not either allowed to travel to or you're not supposed to be traveling from. Right now, there are only 11 airports in the United States that are allowing travelers from these countries back. When those people get off of the plane, they are being checked. If they are sick, they are being quarantined right where they are. If they are well, they're given that little card that's down there on the right, and they are to call the health district when they return. We're not just relying on self-reporting, though. There is a group at the CDC. I can never remember their initials. I should remember those because I say that every single time. But they call the Department of Health here in Ohio. The Department of Health calls us, tells us, these are your people that need to be monitored. Those people are quarantined, and we're monitoring them every single day. We already talked about testing. Obviously, prevention. There is a vaccine in the works. Even in the best case scenario, vaccines typically take at least 6 months to grow, and that's best case, nothing happens to hurt that production. So they're saying right now 12 to 18 months. That before we would have one. The best thing that we can all do is take care of ourselves. Don't go places if you're sick. Wash your hands, wash your surfaces. You know, if you are in a business like this, up your cleaning a little bit. And I know Brian said that for your county offices, they've brought some people in from the night shift who are going to be doing more frequent cleaning of your surfaces. If you do have customers that are coming in and out, go ahead and wipe down things between each customer. People are going to understand that. I did get a request this morning from the courts. Could we please give them some good signage about social distancing so when people come in, they kind of understand why they're stepping back a little bit? So Tracy Whitaker, our PIO, who's back here, she's making some signage like that. We'll get that out to all of our businesses and all of our community partners so that they can use that. I would also say if there's something that you think we're not giving you information-wise, just let us know. Tracy can kind of think on her feet, and I asked her the other day for something, and within probably 15 minutes she had it for us. So we do want you all to have the very best information that you can have. We have a newsletter you can sign up for. We've sent that link out to several people. I think Brian sent it out to all of the county. Tracy is sending that out at minimum once a week, but it's going out more frequently if there are lots and lots of changes in what we're doing.
Sheila, do you have anything that's geared towards like social media, like blasts and stuff like that? A lot of the guidance document from CDC is very technical and a hard read, and it seems like we could send out some of that stuff on social distancing.
Absolutely. So you all know our Delaware PIOs, public information officers, work excellently together. Sean and Tracy have been in conversations about opening up the virtual JIT, which is a joint information center, so all the PIOs would work together and get all of those same messages out. But yeah, Tracy and Megan Edwards is our media specialist. Absolutely. I don't think you don't know any. I mean, you know all of the PIOs in the county. Yeah. Okay, so we're making sure that all of the messaging, because I think the other thing, besides making sure people have good information, we have to make sure people have consistent messages. We're conversing with the Ohio Department of Health to make sure our messages are the same as theirs. I mean, I will confess, it threw us all for a little bit of a loop, some of the stuff that the governor said, not in yesterday's conference, but the one before, because it was a little different than what we had all been talking about. So my assumption, and I think I was right at the time, was something had changed since our 11 o'clock call until that 2 o'clock meeting, and that was that we had gotten some of those positive cases back. This is something, I don't want you to get hung up on this a lot because, again, as I said, flu is a little different than COVID. Flu is not quite as infectious as this appears to be, but this is something that we had put together when we were doing all the pandemic planning, which public health has been doing for, gosh, I've been in public health for 22 years, and it feels like we've been doing it the whole 22 years. But this is just a little slide to kind of show when would we think about doing these various things. Now, again, if the governor comes out today and makes some blanket statement, that could change all of the things that we've been planning for locally. But this is just a little bit of a general guideline. The other thing that Dr. Acton said yesterday, she's the director of the Department of Health, she said yesterday that if you do have community spread, which we know now in the Stark County case, it appears to be community spread, but right now there was just one person. She said if you have two people in a community that they're not connected to each other, and you can't figure out how they got it, that would be considered then at that point community spread, and you could theoretically believe that about 1% of your population probably is infected. Now, it doesn't mean that they're all going to die. It doesn't mean they're all going to need to be in the hospital. We know that there are people who get the flu every year. They're sick for a little bit. They go on about their lives. Everything is just fine. So it will be the same way with the COVID-19. If that statistic were to come true, and once we have community spread in Delaware, that means about 2,048 people in our county would be infectious. Doesn't mean they're all going to be out and about, because hopefully they're following all of these guidelines, and if they're sick, they're staying home. We do know that it appears, I hate to be like that, but we're still learning so much about this disease. We don't think that you're infectious before you have symptoms. That's a really good thing. One of the reasons that the measles R naught is so high is because you are infectious 4 days before you show symptoms. So that obviously you're walking around and, you could be spreading it. We don't think that this is happening with this. There's not a lot of study yet done. The World Health Organization sent a team into China. We got a really good report back from them. They've sent a team into Italy, and we're getting more and more information every day. So the more we learn about this, the more that we can help people to prevent the spread. But I just put that up there just, again, you can't take this to the bank because this is pandemic flu. This spreads a little bit more quickly, but this is kind of when we would start thinking, if we make that decision locally, when we would do things. The superintendents and I, we've talked now, I think 4 times since Friday, about when would we do these things? When would we think about closing? And, there are a lot of things. There's not a set number. They're looking at what is their normal attendance rate. Can we ask some more intense questions? We do surveillance with the schools all the time. 52 weeks a year, we get information from the schools. So what would that number be if it's normally 94%, if it drops to 80, is that the number? We're having those conversations. Probably the more finite number for them is their staff. And they all they didn't laugh that it was funny, but they all said it's going to hit us first with our bus drivers. If they don't have enough bus drivers to get the kids to school, that would be a determining factor.
Sheila, do you anticipate the schools making determination, because the schools and the child care providers will have a huge impact on our workforce?
Absolutely.
I mean, if the kids can't go to school, our workforce is, it's going to be really hard to be able to manage those situations.
Absolutely, absolutely. That is one of the things we are asking businesses to do, is to think about what would that look like for you. How many of your people do have kids in daycare or in school that are not old enough to be left by themselves? So what would happen is each superintendent certainly has the authority to do whatever they want to do in their schools. I have the authority to do a blanket school closures if that's what we decide that we need to do. Obviously, the governor can supersede my Just like he can supersede some of the things that you all can do. So that's how that would work. Right now, all of our conversations have been about the planning, what would they do about distance learning, how do they take care of their special needs students who have extra things. One of the considerations if you close schools is that ripple effect. It's the parents, it's most of the time, the literature shows most of the time, if you cancel schools, especially with the older kids, they don't stay home. They're all wherever kids gather. We don't really have a mall up here in Delaware, so I'm not really sure, and I don't have young kids anymore. I don't know where our kids gather up here, but the statistics show that that still continues to happen, so there's really no social distancing going on. What do you do about children whose only hot meal is the meal that they get at school? What are we going to do about those kids? So there's all of those things going into play, plus then I feel for the schools because then they've also got all of their union issues with the teachers and the staff and all of those, but we are working on all of those things right now with them. As a matter of fact, as we walked up here, I was on the phone with one of the superintendents who was having a staff meeting, and we kind of reiterated, these are the things that we're going to think about before we think about closing schools. Now, obviously, if we have a student or a teacher, staff member who is tested positive, that's going to change that a little bit. We would have to look at, is it the whole school? Is it just that classroom? But this is what we do every single day. Every time we have a reportable communicable disease, we work with the school, we send out letters appropriately to either that classroom or the whole school, depending on what the illness is, and we would implement all of those same practices. And I'm positive I've talked more than 20 minutes. Is there any other questions?
Yes, I'll lead off. I'm sure there are a whole bunch of questions. You've been very comprehensive, and I want to compliment Sean and Brian and yourself, Sheila, for all the legwork and preparation and communication and so on you've done. Since it started in China, what's now the situation in China in terms of new cases and so on?
It appears to be decreasing.
That's what I had heard, but you hear so many things.
It appears to be decreasing. I did hear on the news, now I take all of that with a grain of salt.
Yes,
but I did
exactly.
just hear that a 100-year-old person just recovered from it, which would be the oldest person who's actually recovered. I take it with a grain of salt. But yeah, I have, all of the things I've been reading is that it has dropped a little bit. Now, sometimes with diseases, and again, we're learning more about this, you'll see an immediate decrease because we put all this stuff, and then you could see another one. One of the questions I keep getting asked is, will this go away in the summer? Well, the flu typically drops in the summer, but we just really don't know yet whether this will. With SARS, we did see some of that where we had some peaks and valleys. MERS is another one of these viruses. We still continue to see MERS cases. We don't really see SARS cases anymore. So, we don't know some of those things, but we are watching those things carefully because that will tell us maybe how it will react once it gets to the United States with widespread community.
Question is, can we trust the numbers we'll get out of China?
Well, you know what, Commissioner? We don't know the answer. I trust the World Health Organization and I trust the CDC. We did just get a very comprehensive report from the World Health Organization about China and really studying the disease itself and the virology and all of those things. So I do trust that. Do I trust what I hear? I trust my sources, just like you all know. Hopefully you believe that we are a trusted source of information.
I'd just like to thank you so much, too. I was at the briefing last Thursday that Brian and Sean put on along with you, Sheila, and I had the chance to ask some questions, and many of our department heads were there across the board, many people. It was full. And I think you answered, certainly concerns at that point, and you're continuing to educate us. And I think with your website, too, and you, like you say, that it's not only daily that we can get updates. We can get them as just, you've got somebody on it all the time.
And Tracy and Megan
very
keep
timely,
our
isn't it?
Facebook page, Twitter, all of those things. She was trying to teach me how to do my tweeting the other day. I'm not very good at that. But we do want to give you all the greatest, and that newsletter that we're pushing out, as things change, we're going to push that back out.
Okay.
Her last one had cleaning information, which was kind of newer for the public. We've talked about masks in there because everyone seems to think that you all need to put on masks. What we all need to remember is masks are for the sick person, not the well person. And if people are buying them up, then those are masks that are not available to healthcare workers who need those or to that sick person who really needs it. There was one other thing that was in the newsletter, just this last one that was brand new. That's right, that's right. So the call center is open at ODH. I think right now it's open 8 to 8. We are telling people if it's just a general COVID question, we're referring them to that number to help my staff be able to work on the things they're working on. But if it's a provider, though, we need to be talking to those people because they're usually calling to figure out whether we should be doing testing or not.
Another comment I have is, I just kudos to the residents in our county. I was at the Mills and Wills yesterday, and we're in many cases talking about seniors in that case, but no handshakes, and everybody was following the guidelines as they understood it, and a number of organizations in our county have canceled large meetings. So I think everybody's taking it very seriously, and that will make a difference.
And Meals on Wheels, Farah called us probably 2 weeks ago. We've had a staff person down there every day this week working with their volunteers, doing some education about what to do, what not to do. Farah just sent me an email this morning. We're actually going to talk at 7:30 in the morning because she knows she has a very fragile population. We actually talked. When did we all get together? Someday this week. And she was going to start implementing having, when they signed in, have you been sick and have you traveled or have you had a fever in the last 24 hours? And if the answer to any of those is yes, she's turning them away, which is sad, I know, because this is maybe the only social interaction that these folks get, but we have to be careful. Wasn't that this week? It was. Okay, Tuesday. My days all run together.
Right.
I went to the Brown Township trustee meeting Tuesday evening, and formerly our own Megan Edwards was there, and she
Yes.
did a really nice update to the people who
Megan
were
is
there.
our new representative to Brown Township. I was actually supposed to be there, but I was on a something with Troy Balderson that evening,
Right.
where he has people call in and ask questions.
She did a great job. And I would also like to acknowledge Jane and Dawn, who have done great work working with our departments and the other offices, representing the commissioner's office and the county, obviously, in
We are
working with
so
your folks and so on. Yes, everybody's working well together. We're getting the communications, we're getting the information out, we're doing everything. And again, I can't compliment you and Sean and Brian and Jane and Dawn enough
Thank you.
that we continue to fight this thing.
Our staff appreciate that, and I do try to always share that with them. Deanna Brandt from Mental Health just texted me this morning and said, what do you all need from us? And so I know that
that's great.
some of my team is getting really tired. And so trying to,
Yes.
make sure that we bring in other people so that they can have a break. And, it does get emotional. I was in a meeting yesterday with the sheriff's office, and I got a little emotional, and one of the captains said, it's okay. We all get emotional about these things. You're trying to protect everybody. So we're trying to take care of we have to take care of all of us too, because people are looking to all of you for guidance.
And if you see anything we should be doing too.
Yes,
If there's
that's
any way we can help, please let
Okay,
us know.
thank you.
very important point. Anything we can do, whether it's our team or communication or whatever, we're
Yeah,
glad to
Sean
help.
and I are trying to decide if we're going to open up the EOC and how that would look, but we're meeting today at 11, so
Okay, yeah.
thank you so
All
much.
right, well, thank you
Thanks
for coming.
giving
I
us
know
the
you got a
time.
very busy schedule and getting the
Please
word out.
don't distribute this widely. I will send an updated one at the end of the day today with the better numbers.
Yeah, we'll wait.
Yeah.
Thank you.
Thank you
Good,
very
thank you.
much.
All right. I think we can probably run through the agenda pretty quickly
I am
and then do the hearing
Yes.
at the end of the regular agenda. That way we keep things moving.
Sounds good.
Resolution number 20-244, in the matter of approving purchase orders, then and now certificates and payments of warrants and batch numbers CMA PR 0311.
So moved.
Second.
Discussion, vote?
Vote on motion 20-244. Mrs. Lewis?
Aye.
Mr. Merrill?
Aye.
Mr. Benton?
Aye.
Resolution number 20-245, in the matter of approving travel expense requests.
So moved.
Second.
Discussion, vote?
Vote on motion 20-245. Mr. Benton?
Aye.
Mr. Merrill?
Aye.
Mrs. Lewis?
Aye.
Resolution number 20-246, in the matter of approving supplemental appropriation for juvenile court.
So moved.
Second.
Discussion.
Good morning, Karen First, Fiscal Manager, filling in for Karen Watkins with Juvenile Court. She's requesting the supplemental to take care of an accounting error. They received a check that was intended for Union County, so they need to reimburse the money. So,
All right, vote.
Vote on motion 20-246. Mr. Merrill?
Aye.
Mr. Bitton?
Aye.
Mrs. Lewis?
Aye.
Resolution number 20-247, in the matter of approving modification number 1 to the agreement number 18982 with ACOM Technical Services Incorporated.
So moved.
Second.
Discussion.
Good morning. Excuse me. Good morning. Rob Riley, Chief Deputy Engineer. This agreement involves the Big Walnut Interchange study. We've had some very good conversations with ODOT over the last several weeks regarding this project and advancing the project. Based on some recent updated traffic projections, we will need to update the feasibility study for the project. And so that's what this modification involves. I would note all the costs associated with this work will be reimbursed by ODOT. And so this is simply a matter of we hold the contract, but we'll be reimbursed by ODOT.
Boy, very, very important.
Are you fairly optimistic that we're making good progress?
I do think we are making good progress. I think we've got at least a plan of action to get through the next phase of approvals, this being the first one, which would involve vetting all of the alternatives we've looked at, and then moving into more of a procedural approval through the Federal Highway Administration. And so we do expect that next phase will involve some significant public involvement efforts. We've had many of those discussions already, but basically opening up the discussion to the general public at that point.
Great, thank you.
All right, vote.
Vote on motion 20-247. Mrs. Lewis?
Aye.
Mr. Bitton?
Aye.
Mr. Merrill?
Aye.
Resolution number 20-248, in the matter of approving the plats of subdivision for Heathers at Gulf Villages, Section 4 in Maple Glen.
So moved.
Second.
Discussion.
Heathers at Gulf Village includes 26 single-family lots, and Maple Glen is 14 lots off of Africa Road. Heathers at Gulf Village is off of Sawmill Parkway.
Okay, vote.
Vote on motion 20-248. Mr. Bitton?
Aye.
Mr. Merrill?
Aye.
Mrs. Lewis?
Aye.
Thank you.
Thanks.
Thank you.
All right.
Resolution number 20-249, in the matter of authorizing the county administrator to approve and execute a services contract for consulting services related to the PY 20 Community Development Block Grant Programs.
So moved.
Second.
Discussion.
Morning, Commissioners. Rob Platt, Economic Development Administrator. This resolution would authorize us to enter into consulting services for the administration portion of the CDBG grant. As you'll recall, a few years ago, they went to a 2-year cycle, so we're now heading into program year 20 and program year 18, and then in years right before that, the county traditionally put out for consulting services using HUD's guidelines, and where our office really didn't have much involvement other than forwarding papers to you. With the staff that we have and now and the experience on hand, we're able to minimize that down to where we really only need a consultant just to kind of help us through the HUD and ODSA type paperwork. What that has done is enable us to put out an RFP for a minimized amount of services, and then have our staff in-house be doing a larger portion of it. And then we realized a net gain of about 27% of what we had been paying out previously. So we put out an RFP. We received 3 responses for consulting services. The lowest and best that we received was with Flowers Consulting, and so we are asking that you approve us to move forward with that. And doing so, this will kick this off immediately, and we are prepared to move forward for the next round of grant funding. So, thank you.
This is a really important program because it expands opportunities for low-income people and also housing. And as you know, we're working on the housing part too.
Absolutely. The low to moderate income will benefit from this. The savings that we're realizing, then we are able to roll out of the administrative portion right back into the project, so we can bolster
great.
that amount. So that's why this is so attractive to us, and we brought this to you.
Super.
Okay, vote.
Vote on motion 20-249. Mr. Merrill?
Aye.
Mrs. Lewis?
Aye.
Mr. Benton?
Aye.
Thank you very much.
Thanks,
Thank
Rob.
you, Rob.
Resolution number 20-250, in the matter of approving the Delaware County Motor Vehicle Use Policy, the severe weather and other emergency policy, the travel and expense reimbursement policy, and the Delaware County Self-Insurance and Risk Program policy.
So moved.
Second.
Discussion.
Good morning, Commissioners. Dawn Houston, Deputy Administrator. I'm prepared to go over the highlights of these policy changes, but in the interest of time, if you would prefer, I can just answer any questions you may have, but recommend your approval. This is the first 4 of several policy updates that we will be bringing to you this year.
I know you've spent a fair amount of time working on this in collaboration with a whole bunch of people, including us, and I want to thank you for that. I would say if you could highlight the top 2 or 3 items, maybe just go through those and...
Absolutely.
'Cause I think, again, these are changes that have been long in the making, and there are some meaningful changes being made to make it easier and more fair, I guess, is what you describe it, so.
Correct, yeah. So for the first one, the motor vehicle policy, this is actually a new policy for us that separates out the pre and post employment guidelines. And it was a policy that was recommended by Corsa and really memorializes our current practices. The second one, the severe weather and other emergency policies, this actually provides an avenue to have a delayed opening so that we wouldn't necessarily just go to a closure. We could possibly delay for an hour, 2 hours, whatever it might be, and then identifies the current essential personnel. It was revamped quite a bit, actually, thanks to Eric Costello, which was very helpful to have some new eyes on that.
A couple years ago where this would have come in handy.
Yes, exactly.
Right.
And then the travel and expense reimbursement, as you know, we had talked about increasing the amounts for meal reimbursement and adding gratuities for reimbursement, and then also changes the mileage rate to the current IRS rate. And then lastly, the self-insurance policy, it basically just outlines current procedures for reporting incidents and then updates the policy to current practices. So if you have questions, I'd be happy to answer.
Yeah, again, you've done a nice job of keeping us in the loop as this policy evolves, the changes evolve, so I'm up to date on them, and I think we're ready for a vote.
Vote on motion 20-250. Mrs. Lewis?
Aye.
Mr. Merrill?
Aye.
Mr. Benton?
Aye.
Thank you.
Thank you.
Don.
Resolution number 20-251, final hearing for the Villas at Walnut Grove Condominium Drainage Maintenance Improvement Petition Project.
So moved.
Discussion, vote.
Vote on motion 20-251. Mr. Merrill?
Aye.
Mr. Benton?
Aye.
Mrs. Lewis?
Aye.
Resolution number 20-252, in the matter of approving for a specific occurrence a suspension of Rule 3 speaker registration, Rule 4 limitations, and Rule 7's public comment procedure from the rules governing public comment before the Board of County Commissioners of Delaware County, Ohio.
So moved.
Second.
Discussion, vote.
Vote on motion 20-252. Mrs. Lewis?
Aye.
Mr. Benton?
Aye.
Mr. Merrill?
Aye.
Okay, with that, the final hearing for the Villas at Walnut Grove Condominium Drainage Maintenance Improvement Petition Project is open, and some of the rules have been waived. And so I will just go through briefly what we will do today and how we will proceed. First of all, thank you all for coming, and thank you for your patience. For those of you who just joined us, we were going through a coronavirus update that was very important, so that superseded our work on this. So again, I apologize for the delay in getting this hearing started, but very important that we keep on top of the coronavirus situation, and so we needed to do that. So today, first of all, I want to welcome everyone. There is a sign-in sheet circulating room. We ask you please sign in. Copies of the final hearing report are available if you don't have one. Trusting everyone has seen one at this point. Now, in lieu of reading the entire report into the record, sorry to disappoint you, Brett, I won't be able to read this one.
My idea.
Yeah.
Unless there are objections, we will hear a summary of the report before proceeding with testimony. We'll hear questions from the board. Then we will take comments from those in favor of the petition, and then we'll hear from those who are opposed to the petition. During testimony, I will ask you to take an oath. Those speaking for or against the petition must be either an owner, as defined in section 6131 of the revised code, or an attorney speaking on behalf of an owner. We'll continue back and forth if new information comes up or additional people wish to speak. More questions from the board, and then after listening to testimony and the report of the engineer, the board will decide whether to find in favor of the improvement, affirming the order and confirming the maintenance assessments, or the board may dismiss the petition by setting aside the order. And in our deliberations, we consider the following: whether the board hereby finds that the proposed improvement is necessary, that it will be conducive to the public welfare, and that the board also finds it's reasonably certain that the cost of the proposed improvement will be less than the benefit. So with that, I will turn it over to Brett Bacon.
Thank you, Commissioner. I promise this presentation will be brief, but just we wanted to hit the highlights of what's being proposed with this project. Project timeline, September 5th of 2006, the Board of Commissioners at the time accepted the original improvements for the villas at Walnut Grove onto the drainage maintenance program. June 28th of 2018, the petition was filed to add additional infrastructure to the project. October 1st of 2018 was the view, and December 13th of 2018 was the first hearing. The language of the petition is as follows: commencing in Delaware County, Genoa Township, in the villas at Walnut Grove condo, generally following the existing course and terrain of improvement. Further went on to say request to repair, replace, or alter the existing improvements per attached Exhibit C and engineering plan as part of the Villas at Walnut Grove Drainage Maintenance Project number 0628. This map shows the infrastructure that was accepted onto drainage maintenance originally back in 2006. You can see the storm line, a retention basin, outlet structures, and some open channel there on the southeast corner. This consisted of what I just said. I guess I should have hit the button sooner. And the value of that as set by the original petition was $167,920. The base value for each of the 52 units in the condo is $3,229.23, and this is the value that their assessment is currently calculated against. All the units are being assessed a 3% collection for 2020. This equals $98.81 per unit, and that is inclusive of auditor treasurer fees. The additional infrastructure that's being requested, as you can see, it's storm tile, catch basins, curb inlets, and manhole structures. Basically everything in the subdivision that was not taken on, or in the condo that was not taken on maintenance originally. The value of this additional infrastructure is $93,898.46. And the Delaware SWCD has performed an inventory and evaluation of this infrastructure. We have found no significant deficiencies that would require any kind of work prior to accepting this infrastructure onto maintenance.
Now, Brett, the $93,000, is that the current value or was that the original value? When
That's current value.
Okay.
As such, no construction assessment is necessary for the project. So this map shows everything that would be on maintenance, basically all the infrastructure within the condo boundary. Total combined value of that infrastructure is $261,818.46. This would make a revised per unit base value of $5,034.97. We would propose to keep that 3% assessment in place for 2021, and this would equal $154.06 per unit, and this would be projective of the, or inclusive of the projected auditor's treasurer's fees.
That includes the original as well as what's been.
Correct.
So it's
Yes.
a grand total.
Yep, grand total. So your decisions, you can approve adding the additional infrastructure to the project and revising the total base and per unit base values, or you can deny the petition. Approval will require a resolution affirming the original order granting the prayer of the petition, including the revised base values. If the decision is to deny, it is recommended to distribute the costs incurred to this point to the unit owners as our common policy is. And that cost would estimated to be $1,250. The engineer's recommendation, I'll read this verbatim. Based on all of the information gathered for this petition request, I believe that the petition should proceed. It is my opinion that the benefits of the proposed petition exceed the estimated maintenance costs and would be conducive to the public welfare.
Now, if we were to deny this petition, would the existing infrastructure
Would remain on maintenance.
remain in place?
Yes, yeah. To remove that would take a petition to vacate.
And just for clarification, or maybe just an update, this wasn't included originally because,
Policy at the time.
I'm sorry,
Policy at the time.
policy,
Soil and water policy?
No, engineers.
Engineers policy.
Yeah, just what we required the developments to take or to petition for maintenance at the time.
Okay.
so that policy obviously has been changed to,
Condos are a little bit different animal because they're considered private development. I think Brett can speak a little bit better on that than I can.
Sure, please.
Brett Bergerford, Delaware County Engineer's Office. Essentially, the infrastructure that is currently under maintenance was kind of the bare minimum to satisfy our standards from the flood control and water quality perspective, drainage in, drainage out aspect. The infrastructure that is kind of interior to the site is purely for the site itself. It has no impacts on flood control, water quality, or off-site drainage. And so that's the additional infrastructure that they're petitioning to be placed under maintenance, is what is interior. Essentially, what would have only affected them up until this point. So if any...
but based on today's policies, if you were doing it today, you would have done the whole thing at once?
No, our policy still stands as it is, and that is to essentially take the infrastructure that is required to maintain off-site drainage through the site, to maintain flood control, and to maintain water quality for the site, because that's more of a regional item instead of an interior site-specific item.
I guess my question is, what is the tipping point that would make us want to do the additional today?
Today,
Yeah.
it's their desire, the landowner's desire, to have that additional infrastructure placed under maintenance for their public benefit, for their benefit of the neighborhood, for their community. I think that was one of the driving factors. There's some costs associated with it from the standpoint of, as you know, with the ditch maintenance program, we have a routine maintenance and inspection program, and that's an annual aspect, just to keep a better handle on it. So I think from a standpoint of managing it, that would be another reason why they would have petitioned to be placed under maintenance. And then lastly, I would suggest you ask that question to the petitioners who are represented today. They can probably give you some very site-specific reasoning aside from my generalized answers to your question.
This is, we see a lot of these ditch petitions, obviously. This is an unusual one in that there is no construction improvements needed at the time, at the current time.
Correct. And so that's a good indicator because the system itself is in good condition. And that means it was constructed in a workmanship manner. And so we're always happy to see systems that don't require a construction component, because then that's actually less of an assessment, because you don't have the construction assessment as well as the maintenance assessment for the landowners.
Okay.
Thank you.
Thank you, Brett and Brett. Okay. Any other questions for Brett or Brett at this point? Okay, with that, we will now move to asking for anyone who would like to speak in favor of this petition. So. All right.
Morning. Thank you. My name is Larry Walden.
I'll swear you in, if you wouldn't mind,
Oh,
please.
sorry. Go ahead.
Do you solemnly swear that the testimony you're about to give is the truth, the whole truth, and nothing but the truth, so help you God?
I do.
All right, thank you. You can continue.
My name is Larry Walden, and I reside at 5300 Slater Ridge, which is one of the units in this development at the Villas at Walnut Grove. I addressed you back in December as well, of 18, and One of the things that we discovered, and I believe Commissioner Lewis was at this meeting, the reason why we wanted to add this to the existing was a meeting, the Homestead community, which joins our property, and they also drain into our pond. And we said, well, and Milt Link at that time was our contact at Soil and Water. And Milt says, well, they petitioned and they were successful in getting their drainage added to it. So that led us to believe, why shouldn't we do as well? When this process started, I was a member of the board for the condo association at that time. And I know we've had the meetings, we also had the on-site review as well. We're glad that the evaluation of the new part to be added was that it was positive and that the original construction is still relatively sound. So I guess personally as a homeowner now, I'm not on the board, I was supportive back in December of 18, and I remain that way. Because I think it's one system. It'll be easier for Soil and Water if they're still the ones that maintain it. I know they have worked with the board previously. We had one of our units had a leak, and they were kind enough to bring out a team that could evaluate the storm drainage, and they videotaped it to make sure that it wasn't a defective storm drainage it was causing a leak for. So that prompted us, all right, if they can do that, and they can help us going forward. We've also had a drainage issue coming from a property. I think this was the big storm in June of 18 that brought in additional rainwater. It overflowed, came into our property area. The catch basin was just debris and everything else came in. Soil and Water immediately, once we notified them, brought out a crew to clean it up. And again, very supportive of what our rapport with Soil and Water has been very good. They come out and review things with us, answer our questions promptly, so that again is very supportive of why we want one system, one group to maintain it. Any questions for me?
No, I don't think so at this point. Thank you, Larry.
Thank you.
Yep. All right. We will continue. Anyone else who wants to speak in favor of the petition?
My name is Chris Haight. I'm at 6469 Wesley Way.
Okay, I'll swear you in. Sure. If you would, please. You solemnly swear the testimony you're about to give is the truth, the whole truth, and nothing but the truth, so help you God.
I do.
Okay, continue.
Again, Chris Haight, 6469 Wesley Way. I would also speak in favor of the petition. Recently added to our board in the neighborhood, and as I become more familiar with our circumstances, both financially and responsibility-wise, it just seems to make sense to me that our whole system would be covered under the same circumstances, as opposed to, half of it belongs to the county and half of it belongs to the neighborhood, and we're not necessarily equipped to do those kinds of things as a volunteer organization. So I think it makes sense for us to assume the responsibility for the assessment, let the county do the things that they're good at, and life goes on. So,
okay.
Thank you.
Thank you. You're welcome.
All right. Thank you. All right, others? Another gentleman?
My name's Bill Dutch, I live in the area. I'm a little late, pardon me, here, so I guess I'm going to have a couple of questions about this.
Okay, let me, yeah, I need to.
Is that okay, or
I
am I
need
too
to
late, that part of it?
I need to swear you in, so
Yes, sir.
we can have a conversation. Do Do you solemnly swear the testimony you're about to give is the truth, the whole truth, and nothing but the truth, so help you God?
I do, sir.
Okay, if you would identify yourself.
Okay, my
and
name is
record.
Bill Letson, William Letson, grown-up name, I guess, 5427 Slater Ridge.
Okay.
I think that the whole concept here makes a lot of sense to me. Like my neighbor said, get everything tied together, one necktie to grab if there's a problem. I guess a couple of things that I'm not sure I understand on here. It's my understanding that the, excuse me, assessment can be either 2 or 3%. From what other homeowners have told me, am I right on that?
Yeah, that'd be a question for Brad.
A variable number? This 3%?
Yeah, let me, I
Oh,
gotta go to
okay,
the mic.
sorry.
Yeah, the assessment can be variable. We look at that every year and adjust the percentages based on the maintenance needs of the project. Our goal each year is to have an assessment that obviously covers the cost for the year, the projected cost, and part of our report that we prepare every year contains that estimated cost for the year. And then also we would like an assessment that allows us to grow the maintenance account by a certain amount every year so that, over time, a reserve is built up in the account up to, the law would stipulate that we can have up to 20% of the value of the project unencumbered in the account at any time. And our goal is to reach that over, obviously a long period of time rather than to try to assess that all at once. So yes, the assessment is variable. I will say the majority of our projects tend to average between that 2 to 5% range. This is one that, and just I guess having the recency familiarity of preparing that report currently, I don't anticipate that number changing over the next several years. I think that 3% is probably the stable number for this project, but obviously that's going to be, very dependent on how much work needs to be done out there, and obviously less work, we don't need to collect as much, and if we have to, something happens where we have to do a major repair, then we may need to bump that number up a little bit.
Do you know what the balance is in the reserve?
It's about $2,000 right now, so it's at about 2 to 3% actually of its the current base value, which is why we're recommending staying at that same 3%. We feel like that number with the additional base will allow us to do those two goals that I spoke of covering the costs and growing the account.
Okay.
If you don't build up a sufficient reserve, then you would end up with a higher charge down the road somewhere to make up for it.
Quite possibly, yes.
Trying
yes.
to find that middle ground.
Yep, exactly.
Okay. Bill, more comments or questions?
Yeah, thank you, that was very helpful. I guess my original thought when I saw this is the report from these folks said the system's in great shape, there's no work needs to be done, so why wouldn't we be charged the minimum as opposed to 50% more? I mean, if they're not anticipating any significant work needs to be done, obviously we need to keep some money going into the system, but if every one of our tax assessments, they choose 3% over 2%, my taxes are 50% higher. So I realize it's only 1%, which looks small, but when you talk about the dollars and cents involved, that's not the way it works out.
Yeah, Brett could.
When we say no work needs to be done, that means no remedial work needs to be done on that additional infrastructure to bring it up to our current standards. There's obviously ongoing maintenance work, as the other gentleman alluded to. Every year we're required at a minimum to inspect the projects. I know we've done some stabilization work out there. Obviously with the time that this project has been on maintenance, for it only to be at the 2 to 3% value of the original infrastructure, we've had to make some expenditures out there to keep that system operating. So I don't want there to be confusion between, we don't need to do any work to bring this infrastructure up to speed, but there's obviously ongoing maintenance work and costs associated with that.
Some work's required to maintain that level.
On an annual basis, yes.
Right. Okay.
Do you happen to know by any chance kind of what your cost, I don't know how you measure it, per yard, per foot, whatever it is for maintenance on something like that, just to help me understand better?
I'd be happy to sit down with you and show you. I can pull up our reports back at the office. I don't have that information at my fingertips today,
Okay,
though.
I mean, I just,
More than happy to, though, yes.
I guess somebody moved into Delaware County 20 months ago, I've seen my taxes go up over 10% in that amount of time. So it seems to me that we're just ringing this bell and ringing this bell and ringing this bell. And at some point, it's got to stop.
First of all, I wouldn't consider this a tax. This is basically an insurance policy to protect you long-term.
Well, it's on the tax bill,
And it
so
helps
it
the
feels
values
like
of
a
your
tax.
property. So I'm not sure that's the proper terminology, but
Well, when it comes on my tax, let me say just the items on my tax bill have gone up by 10%. Nomenclature is one thing, but the reality of the check I write every 6 months is different. And it just seems to me like we're adding incrementally kind of wherever we get the chance, as much as we get the chance, instead of seeing where we can cut things back.
this was a petition filed by the neighbors in your neighborhood that felt this was necessary.
I understand
We're just
that, sir.
fulfilling our responsibility to evaluate in this hearing. Your neighborhood, your neighbors are the one that felt this was necessary.
I understand that, and I agree with it, but it just seems to me that, I guess I come from the business world where we always look at what's the least cost we can get for the value, or what's the most value we can get for the least cost, depending on how you want to look for it. And I just want to make sure our tax dollars are being, or our insurance dollars, or whatever you want to call them, are being treated in the same way. And when that bill goes up a little over 10% in 18 months, I'm not sure that's what's going on around here. That's just my feeling. So, I mean, you guys.
Maybe speaking with
that's-
Brett will help
Yeah. Yeah.
give you some
And-
more.
And your comments, I think, are more focused on the broader tax issues,
Yeah.
like school property tax
But
and others,
this is one more
which,
example, sir.
pardon me?
It's easy to say, well, it's the taxes, or it's the new police station, or it's the water maintenance, or it's this, but they're all pieces of the whole.
Yeah, but we're only here today to talk about this particular
Okay,
issue.
but I'm just saying this is one good example of what I'm concerned
Well,
about.
and the other point maybe I'll help, that money still belongs to that neighborhood that's in escrow, for lack of a better word. It's still your money, it's being held for the purposes intended, but it still theoretically belongs to the neighborhood, correct, Brett?
So there's an individual account for
Yes.
each one of these projects?
Yeah, we have 561 projects currently on drainage maintenance. We have 561 different accounts that we track the income and cost to and end-of-year balances. And as I'll restate, I'm more than happy to sit down with any owner in any one of those 561 projects and go over, the costs and the collection history. I think we've been fairly stable on that 3% collection for villas at Walnut Grove over the past several years. So it's not something I see going up. It's like I said, it's fairly stable, I think. So.
Okay, thank you.
All right.
Go
Well,
ahead.
yeah, anybody else want to speak in favor of the petition? Okay, anybody who wants to speak in opposition to the petition? Last chance, anybody who wants to speak in opposition? All right, with that,
Could you read the,
Resolution number 20-253, in the matter of closing the public hearing to address the Villas at Walnut Grove condominium drainage maintenance improvement petition project.
second?
discussion. Vote.
Vote on motion 20-253. Mr. Benton?
Aye.
Mr. Merrill?
Aye.
Mrs. Lewis?
Aye.
Okay, the hearing is closed.
I would ask that we read to affirm.
Resolution number 20-254, in the matter of the Commissioners affirming the order and confirming the assessment for the Villas at Walnut Grove condominium drainage maintenance improvement petition project.
So move.
Second?
Discussion. Vote.
Vote on motion 20-254. Mr. Merrill?
Aye.
Mrs. Lewis?
Aye.
Mr. Benton?
Aye.
We do have need for executive session this morning. Resolution number 20
Let me just, the hearing is closed, the petition's been approved. You're welcome to hang around if you want to, but it's pretty dry from here on out.
And I will back up, we do have administrative and commissioner reports.
and
Yes.
Nothing to report.
All right. Commissioner Lewis.
attended the Families and Children's first meeting the other day, And the only people there were Bob Anderson and Steve Sikora and myself, because everybody else, Sheila?
Yeah, health
had
district's distracted.
other things and that they were working on, and other people had various commitments. So anyway, I had a nice discussion about jobs and family services and just a little general discussion. And they gave me the finance report, and that was it. Just one other thing, I believe we are still in need of poll workers. Some of the elderly poll workers who we have, needless to say, some health concerns with the coronavirus and didn't want to work the polls. So anyone who is listening who would like to work the polls on Tuesday, please contact the Board of Elections. Our employees can actually, we provide service days for our employees, and this is a recognized service day to work the polls. I know some of our employees have already signed up, so maybe some others will sign up. And that's it.
Good point. Seems like we're always short of poll workers, and this year seems to be exacerbated by the coronavirus issue. So.
I just want to reinforce that. I spoke to Carla yesterday at the Board of Elections and told her I'd make a statement, but you beat me to it. And that's great. There is a shortage just due to some of our concerns expressed by some of our older poll workers. And it's obviously having an election that goes smoothly is beneficial to everyone in the county. So I encourage anyone who has an opportunity to be available next Tuesday to please consider doing that. And as a poll worker in the past, I can't do it this year because I'm on the ballot, but as a poll worker in the past, I tell you that it's a long day, but it's a day that you will find at the end of the day, you're glad you did it because you really made a difference in your county. So please consider that. We had a DKM board meeting earlier this week, and we all three were in attendance. Thought it went well. Meals on Wheels yesterday, I did not get an opportunity to go out with someone. I know you did. And that's always a great opportunity to be involved and really see the work that's being done out there. And lastly, the Corsa board meeting tomorrow, our board meeting is tomorrow. Next week there'll be a webinar for the general meeting because of the virus. That's all I have.
Yeah, on the Meals on Wheels, I did go out, at least for part of the route, and the Source Point driver volunteers are adjusting their procedures so that they do protect the seniors who are receiving the Meals on Wheels meals. And so, you know, they're recognizing, they're keeping the distance, they're not having them sign, and they're doing some other things just, again, to protect that at-risk group. So it's always good to see that there's so many volunteers, and we're helping citizens who need some help, checking on them as well as delivering a good meal. So,
and, you know, the volunteers on Meals on Wheels, these people, week after week after week, one day, 2 days a week, whatever they volunteer. I mean, they really, these are people in our county that really serve an integral part of what this county's all about.
They really, and they've developed relationships with the people that they bring meals to. It's just really neat.
They're really a lifeline.
They are a lifeline, a good way to describe it. Went to the Brown, as I mentioned before, went to the Brown Township trustee meeting on Tuesday evening, and Megan Edwards was there from the health district, and she was talking about coronavirus, and things have changed since then, and she's getting around to all, you know, there's so many different jurisdictions and organizations that need updates and are anxious for information, so she's providing a valuable service. It's good to see Brown Township has a lot going on. They've got the Kilbourne project that is revitalizing the center of Kilbourne with some new projects, and just really neat. I know our Economic Development Department had a role in that, and they're revitalizing Kilbourne, and it's just really neat to see. They're doing a lot with Hogback Ridge Park and the road and so on. So it's just really neat to see that, and they're trying to get some planning in place so that they're prepared for the growth, which is creeping their way. So I applaud the trustees for their work on that and the zoning people there. And that's it, all I've got.
I just have to
one more thing.
welcome Gary.
Yes, welcome,
Thank
Gary.
you for sitting through everything. Gary
Yeah,
Busick from
sorry
the
to-
Gazette.
This is a little longer one than we normally have, but there's a lot going on, as
Yes.
you saw. So we do have need for executive session.
We do. Resolution number 20-255, in the matter of adjourning into executive session for consideration of employment compensation of a public employee or public official, to consider the sale of property at competitive bidding for pending or imminent litigation, for security arrangements and emergency response protocols.
So moved.
Second?
Discussion, vote.
Vote on motion 20-255. Mr. Merrill?
Aye.
Mr. Bitton?
Aye.
Mrs. Lewis?
Aye.
All right, we're in executive session.
Resolution number 256, in the matter of adjourning out of executive session.
Second.
Discussion, vote.
Vote on motion 20-256. Mrs. Lewis?
Aye.
Mr. Bitton?
Aye.
Mr. Merrill?
Aye.
All right, we
Resolution
have,
sorry.
adjourned out of executive
Yes, we have
session.
two pieces of other business.
Yep.
Resolution number 20-257, in the matter of approving the One Ohio Memorandum of Understanding related to ongoing opioid litigation.
So moved.
Second?
Discussion, vote.
Vote on motion 20-257. Mr. Merrill?
Aye.
Mrs. Lewis?
Aye.
Mr. Bitton?
Aye.
Resolution number 27-258, in the matter of delegating emergency authority to the county administrator for related COVID-19.
So moved.
Second.
Discussion,
Any questions after you review that?
yeah, I think we're ready to move. Give Mike the authority to do things that need to be done quickly. So,
In case of emergency.
in case of emergency, yes.
Yes.
Okay, vote.
Vote on motion 20-258. Mr. Bitton?
Aye.
Mr. Merrill?
Aye.
Mrs. Lewis?
Aye.
All right. I think that's it for today. We're adjourned.